Okay, you should get a message and you should say yes. Welcome to Therapy Ed's online office hours. What we're going to look at tonight is we tried the online office hours to look at must-know, really foundational information. And tonight what we're going to look at is aging, right? Adaptations to aging and also low vision. And then at the end, we'll have some time for questions if people have other open-ended kind of questions. I'm Marlene Morgan, and I'm going to be your instructor for this. And again, sometimes I look like I've stopped because I have to let people into the waiting room. So that's just me doing kind of two things at a time. It's important for you to know that the information that comes in this online office hours is the intellectual property of Therapy Ed, and taking screenshots and whatever and sharing information would be a violation of Therapy Ed's, their ownership of this information. What I want us to do is turn off your mic while the background is going on. When you want to ask a question or if we're in a discussion, absolutely unmute your mic. If you could, for me, open your video so that I can see you, it's just a lot easier and a lot nicer to look at faces instead of black boxes. I'm a pretty relationship dependent kind of person. That these online office hours are recorded and they'll be posted to Therapy Ed's YouTube channel, and they'll stay there for 30 days. We used to do it within 2 days. I'm not sure we're good with the 2-day thing. You might have to look for it. But what it will be then, it will be there. Yeah. What I'm going to ask you to do is just mute your mic until you want to ask a question, so that they'll be up on the Therapy Ed YouTube channel for a month. What I'm going to ask you to do is, if you have a question, put it in the chat box, and I'll kind of look at the questions and I'll answer them sort of in chunks to not break up the flow of the presentation. But if you have a question, put it in the chat box and I'll answer it. In this session, again, we're going to address adaptations to aging. And this is part of the chapter in the review and study guide. It's a component of that chapter 5, human development across the lifespan. Sometimes when we think about human development, we kind of narrow our focus and say, oh, this chapter is going to be completely pediatrics. But it's human development across the lifespan. And we're also going to look at low vision. Those are the two topics that we're going to address. And I want to think that, for a lot of people, for a lot of older adults particularly, these topics can be interrelated. The whole thing of the changes that occur with aging and then low vision, we're going to see that they can be interrelated. What I'm going to ask you to do is follow the outline in the review and study guide, or if you don't have your book with you, make some notes there. What you'll see is at the top of the selected slides will be references to the pages in the OTR and the OTA review and study guide. And as we look through this review and study guide together, and as you look at it more in detail without me, I want us to pay special attention to the hints and the cautions. We're going to see green boxes that are hints, and those hints really will give us some information about, why does MBCOT think that this is important? Sometimes we study a topic and we kind of say to ourselves, why are we looking at this? Why are we studying this? Those green boxes are going to give you some insight into what Therapy Ed knows about how MBCOT structures the test. And then there'll be some yellow caution boxes. We'll see some of those through this presentation. Those are things to be cautious about. And then we'll also see some red boxes. And those red boxes are going to be really pay attention to this kind of thing. As we look particularly at typical aging, it's not limited to specific diagnosis. We're not really going to talk in this session about like CVA or Parkinson's disease. If you look at the topics for the online office hours, those are topics that will be looked at under like neurological kinds of conditions, whatever. We want to really focus on typical aging and sort of the adaptations to aging. And then we'll move on to low vision. If you look at the topics in the online office hours, and actually I did these, we did one on home evaluations and on fall prevention. you're going to begin to see as you study that many of these topics really are interrelated, and we'll make some points about that as we move along. So let's look at aging first. It's pages 203 to 215, and this is the 10th edition of the OT Review and Study Guide. And then pages 183 to 195 is going to be in the 5th edition of the OTA Review and Study Guide. Now, again, the focus here is on aging. It's not a diagnosis. And we know that aging is a process that varies among and within individuals. We have an idea of what the process is, and then we're going to be able to kind of tag a person or assess whether our client, where they are on this process of aging. This information is dense, but I think it's important. It's kind of like looking at the developmental sequences under pediatrics. Assignment that I give students that I teach in adulthood and aging is they have to do a series of evaluations and screenings that we learn in the test, in the course, and they just have to answer a very general question. Is this person aging in a healthy way? And that's why I want us to kind of think about this as being foundational to that. Now, what I want us to think about is as we look at aging, that we may see over time that things kind of have a slow decline. Things decline over as we get older. And something to kind of layer on top of that is if a person is just sort of aging in an average way, and then they sustain a stroke or they get a diagnosis of Parkinson's disease or whatever, that changes for many people that aging trajectory pretty dramatic. So keep that in mind too. A diagnosis on top of normal aging can really change that. When we think about why do we want to know that, we want to think about the background as the OT and how you can really gain insight through the occupational therapy process. And this is one of those exam hints. You know, MBCOT says to us that the application of knowledge about this aging in this section can really help you correctly answer MBCOT exam questions about really working with older adults throughout that whole occupational therapy process. So again, it's really important background information that we know what to expect. For the OTRs, I want you to specifically think about the theories of aging. This is in the OT Review and Study Guide on page 204 to 205. Just have a working knowledge of the concepts of these. As you look at them, and again, in the OTA Review and Study Guide, these theories are not in there. It's a more of a theoretical perspective. When we look at these aging theories, we're going to see that different groups have different views. There are biological theories of aging, there are psychological theories of aging, and also sociological theories of aging. So make a note to yourself as an OTR to just have a working knowledge and working concepts of those. As we move through this aging of specific systems, and that's what we're going to get into next, as you study, be sure to research or Google any terms or conditions that you're not familiar with, because these are in the aging section to enhance your learning and understanding, but we don't always give definitions. So for example, we talk about type 1 and type 2 muscle fibers. You got to go back and look and see if you remember what those are. Orthosis is under the sensory system. You're going to learn information about the areas of aging. But again, if you come across a specific word and you can't remember what it is, you need to really kind of Google that or look it up to be sure you know what that section is talking about. So what we're going to look at is the information that's in the outlines in the Review and Study Guide. And then what I want us to do, we're going to kind of loop-de-doop back to see how you can organize this information to really better understand the exam questions. In each section, if you take an overview of the Review and Study Guide, what you'll see is the section is, just me again attending to the waiting room. In each section, there's going to be aging changes, and that will give us some information about, you know, what happens as you age on the cellular, the biological, the neurological changes. And then it moves into information that becomes even more and more important to us as OTs. It's followed by clinical implications. Now, how do aging changes affect an individual? And that is an OT is something that you really gets us more into decisions. And then in the review and study outline, it'll then take us to strategies. And there are going to be specific strategies that we can use as OTs to either slow, reverse, or help the person compensate for those age-related changes. And what we're going to see is as we look at the questions from MBCOT, or as we try to put this outline into our question frame, that it's important for us to know what those strategies are, that we can look at options for really planning interventions. All right, let's get started. The first system we're going to look at is muscular changes. And again, when we look at this muscular changes, this section is going to integrate age-related changes, those clinical implications, and then strategies for you to think about to either compensate, reverse, or give the person some kind of strategies to deal with that. This is what it looks like in your review and study guide. This is the OTR review and study guide. But again, this is what these sections are going to look like in terms of how they are organized. Now, something that I'm not going to do is I'm not going to read the outline in the review and study guide through all these systems. This is what we're going to think about in terms of how we're going to approach this and what you're going to do to study. First, you're going to study that information in that outline, because then you're going to have that foundational knowledge and information that then what we're going to do in this muscular system thing, we're going to go down to strategies, right? There's a list of strategies that we can choose from. And you want to pay close attention to those strategies. Then we want to look at, there are really two red flags in this musculoskeletal system, that when we're looking at the musculoskeletal system, we need to think about that there's a potential increased risk of injuries and a potential increased risk of falls. So those are important things that are going to come out in this. So as we look at this outline, let's kind of loop back and think about how you can use this to sort of process through a question in the certification exam. Because as I said, I'm not going to read those outlines. That's part of what you're going to study. But let's look at this clinical reasoning process. And I'm making this up. I'm pretending that I made up a question. So let's pretend that the muscular system changes. And the question indicates that the client is experiencing a loss of muscle strength. Okay. And so we say to ourselves, all right, what's the age-related changes? It's a loss of muscle strength. And then we kind of move down the outline. And at one point it says, you know, what can happen with that? Well, they can have, with a loss of muscle strength, the client might have increased complaints of fatigue. Okay. So now we say loss of muscle strength, they're complaining about fatigue. What am I going to do about it as an OT? That's when we go to the strategies in the box. And we see some strategies. We see a strategy that says we want to increase their level of physical activity. Okay. And we also see a strategy where we want to provide strength training. And again, what we need to be sure is that the strategy that we pick matches the age-related change and the problem that the person is experiencing. So that's an example for that one. If we look further down the outline, the next is skeletal system changes and adaptations. And again, those are the pages in the review and study guide. And the review and study guide is the same for the skeletal system changes as it was for musculoskeletal. Again, when we look through here, there are two really interesting things. We have a caution box related to musculoskeletal. With prolonged sitting, the tendency to develop hip and knee flexion contractures increases. Why is that a problem? Well, you know, hip and knee flexion contractures can really impact mobility. And then a red flag that with changes in that skeletal system, increased risk of falls and fractures. All right. Again, first, you're going to study that information in the outline. And then what we're going to do is we're going to next look at an example of how you can integrate this outline information. And we already said that there are two cautions in the skeletal system that we really need to pay attention to. All right, so let's make a question for ourselves and how we're going to use the review and study guide. let's pretend that the question indicates that the client is experiencing postural changes, senile postural changes. Okay, so that's going to be really a key concept. And we go, okay, so what's that age-related change according to the question is a postural change. And then we think about, why is that important? What are the clinical implications of that? Well, we know that joint health and mobility are really important. Joint health and mobility are important. And so we now look at a strategy and we say, okay, what can we do with these postural changes? Well, this is the box right out of the review and study guide. Well, we could do postural exercises. We could look at good posture. We could look at weight bearing. Again, when we look at the strategies, we want to relate them back to the issues that the client is experiencing, skeletal changes. The next system is neurological changes. And again, people say I'm a rehasher. People say I'm repetitive. I am. I'm repetitive and I'm a rehasher. The review and study guide format, again, is the same for the neurological systems. And so you're going to study that information. And then let's think about how you might use it. In a neurological system question, let's pretend that the question says that the client is experiencing changes in synaptic transmission, okay? And they're experiencing changes in spinal cord and peripheral nerves. Okay, and that's interesting. But when we get to the what does that mean? What is that doing for them? We come across things like they're experiencing a slowing of neurological processing, and their movement is affected specifically in that speed and accuracy trade-off, right? When we look at that speed and accuracy trade-off is, for some people, the faster they go, the less accurate they are, right? And we get to a point with aging where we say, well, maybe speed is not the most important thing. Maybe accuracy is more important. So they have the speed and accuracy trade-off, and movement is affected by that. So then we would say to ourselves, okay, what are we going to do with that? Well, if we look at the strategies that we have, is that we could provide effective strategies, things like allow for increased time for the person to do it, allow for increased cautionary behaviors to be sure that if they're going fast, that they're also safe. So again, looking at the strategies, we want to find those that best match the problems that the person is living with. There are also changes in the sensory system and in the older adult. And you'll see in the review and study guide refers to changes in the visual system, the auditory system, the vestibular system, and also the somatosensory system. Again, when we look at what are some of the cautions or some of the red boxes in this area, we say, changes in the sensory system might lead to really decreased functional mobility and also increased risk of injury, that we're not picking up information from the environment. And what's happening then is those limitations in our sensory system are making us or may make us move more inaccurately or also increase our risk of injury. For the sensory system, what we're going to do is also look at in the sensory system, this section in the sensory system also has some information about selected disease processes, right? In the musculoskeletal and the neurological and in the skeletal system, we didn't talk about specific diseases. But in the sensory system, it's important that this section also has information about selected disease processes related to that sensory system. So for example, vision here talks about age-related things like macular degeneration and glaucoma, etc. Hearing is going to introduce us to the types of hearing loss. Vestibular, things like Meniere's disease. I couldn't get that accent on my slide. Somatosensory has some complications of diabetes. Under gustatory and olfactory, there are no specific diseases. But in this section, as you're looking at the changes that occur with aging in the sensory system, think about some of the specific diseases that are here in the review and study guide related to the sensory system. Again, for the sensory system, you're going to study that information in the outline. You got to promise me that you're going to promise. You know what? We need to mute your microphones. Thank you. Study the information in the outline, and then now let's look at an example of how we can integrate this information into, potential questions. We need to mute your microphone. Thank you. So for under the sensory system, let's just say that this particular question talks about a person who's experienced like a hearing loss. That we go, okay, they have hearing changes, specifically a hearing loss, presbycusis. And again, you have some choices, right? They have presbycusis. And we're going to look at our box of strategies for hearing changes. And I would argue that, the first 4 of these actually would relate to presbycusis. Minimizing auditory distractions, speaking slowly and clearly, using nonverbal communications, providing written and demonstrating directions. And then again, thinking about the, please mute your mic. You know what? Please mute your microphone.
No, but right now your dishes all soaked until
Oh, okay, hang a sec. All right, let me do that.
But Papa is very sick because your dishes are so moldy.
All right. Oh, good. Thank you. I was trying to do it through the participant list through the weight room and it wasn't working. Thank you. You're a hero for that. So this person, again, what we want to think is if they're experiencing presbycusis of all the hearing things, what does that mean? And what's going to be the best strategy? Then there are cognitive changes that occur with normal aging. And again, when we get to the cognitive changes, the format is going to be the same. It's going to be the same for the cognitive changes as it was for the others. You're going to study the information in the outline. And I know I keep saying study, 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 because while we say that, there are really no just knowledge-based questions in the certification exam. Like they're never going to ask you, the biceps is innervated by what nerve? They're never going to just be those knowledge-based questions. But you have to have that foundational knowledge in order to really look at the application and analysis questions. So you want to study that information. And let's look at an example of how cognitive might work. All right. So this person under a cognitive system change, it says specifically in the question, let's pretend that they have problems with tasks and they're having just slower perceptual speed. Okay, their perceptual speed is getting slower. Okay, what does that mean in terms of like the clinical implications? What's that going to mean for that person? Well, they are going to take a longer time completing tasks. Okay, so let's sort of think about what are we going to do about how can we sort of fix that? Well, we can look at maybe helping them increase some mental activity, helping maintain them being engaged, using some cognitive training, provide multiple sensory cues to sort of help them make sense of things perceptually so that they can really process things more clearly. So again, making sure that when we look at those strategies and we're thinking of the strategies in the boxes, we're not only thinking about what they are, but also kind of how we would use them and when would we pick a specific strategy for a client related back to the issues that they're facing or the challenges that they're facing that should be coming to us from the question on the certification exam. There are changes in the cardiopulmonary system, comes up next. Again, the format is the same for the cardiopulmonary system. Again, you're going to study the information, and something that we're going to see in the cardiopulmonary is that there are two kind of cautions there. One says that you need to really complete a cardiopulmonary assessment. Oh, Jennifer has a really good question. So let me take a little bit of a 90-degree turn. Will they tend to just list diagnosis names on the exam, or will they also go into symptoms? Would they just say like a client with presbycusis, or would there be more context clues? Well, something that has a really specific definition, like presbycusis, you're hard of hearing, right? So they might just say that you're working with a client and their family, and the family member they have presbycusis, and you're thinking, oh, the family members are having a hard time hearing them. So they might want you to kind of know something that really has a limited definition like that. But what they can't do is they can't just say you're working with a client who's living with a CVA, or you're working with a client who is living with multiple sclerosis. They have to give you more information about the challenges that that client is facing, whether it's like the symptoms that they're experiencing, or it might be related to what specific ADL or IADL or leisure activities are they having difficulty with. So your question is a good one. Mind the question on the certification exam for as many hints as you can. So again, you know, for some diagnoses that just chronic progressive conditions like multiple sclerosis or ALS, they could never just say, you're treating a client with ALS, what are you going to do, right? They might be able to say, you're treating a client with ALS, what are you going to evaluate? You want to know what you need to know more about. But that's a really good question. They need to give you that information about what the client is experiencing or what the challenges are they're experiencing. I hope I answered that, Jen. When we look at cardiopulmonary, there are two things that come on. One is completing a cardiopulmonary assessment prior to commencing any kind of exercise program. And then, you know, it says in the review and study guide, a lot of older adults can't tolerate maximal testing. So there are some caution kinds of things in there when it comes to assessment for cardiopulmonary condition. And, you know, actually, I think, Jennifer, I think you read my slides mind, because I said, read all of the questions carefully for all the information that'll help you make the connections in the cardiopulmonary and also in the other sections, because knowing that is going to bring you to the best answer. So let's look at a cardiopulmonary one. All right. The client's experiencing a decrease in lung capacity. Okay. So they're having, what would that condition be then? If they have a decrease in lung capacity, they may have a greater respiratory response to exercises. And so we need to kind of think about the answer, or look at the answer that best matches what would do if the person is really having a lung or breathing kind of thing related to exercises. And in this section, I want you to really look at both individual exercise programs and aerobic training programs. Just be sure in this cardiopulmonary that you're able to really look at the differences between those. Yeah, you know what, a lot of times for cardiopulmonary, and let me just sort of take you to, now, I know for cardiopulmonary, there are, there like assessments that is like the diaphragmatic breathe, for COPD, there's like a breathing kind of thing. And it's related to when do they feel dyspnea. So I can't remember the specific name, but it's like a dyspnea assessment. And it would say, you know, when do you feel this heavy breathing? Like when I'm just getting dressed in the morning, or when I'm running upstairs, or whatever. Many of the cardiopulmonary assessments are things like looking at physiological factors more than things like deep breathing, level of exertion. You know, so part of it would be getting the client's perspective about when they feel this, And part of it is going to be looking at physiological factors like blood pressure or breathing or whatever. And then you typically then look at, when you have them in an intervention session, sort of like how were they doing, right? So you would continue to kind of monitor them throughout the session. Good question. Oh, I think, yeah, I did that. Okay. And then there are also other systems. There's an integumentary system, there's a gastrointestinal system, and then renal and neurological. Now, again, you're going to study these, and let's do a sample of how you are going to integrate this information. That in this section, we're going to find that with age, there's like a decreased sensitivity to touch, diminished pain in a lot of people, diminished temperature, and then there's a risk of injury from concentrated pressure or also excess temperature. So safety is going to be first when we look at this. There's also some decreased sweat production, decreased temperature regulation, and also what happens is under the skin, there's a decrease in the subcutaneous fat. So there are some interesting changes that we need to think about as OTs. So let's look at this, and you're going to answer this for me. That the question says that the client is experiencing like changes in their skin composition. Their skin is getting thinner, they have less subcutaneous fat. All right. And so you're making an orthosis for an older adult. How would this aging information, knowing that this person has changes in their skin and also diminished subcutaneous fat, how would that aging information influence your clinical reasoning related to making the splint? You can either unmute yourself and tell me what you would be thinking, or put it in the chat. Knowing that they have these changes in their skin, how would that affect your thinking about making an orthosis? Yes, thicker, more straps, more padding. Keep coming in. Thinking about skin breakdown, right? I mean, we're not worried, but we're always conscious of sort of skin breakdown. Definitely. Placement and amount of padding. Yeah, keep coming. Anything else? The temperature of the material. That's a really good, I don't mean, sometimes when I say people have a good idea, my own students go, do you think I didn't have a good idea? But that temperature is a really important consideration, definitely. Temperature of the material, amount of padding, you got it. The wearing schedule, yeah. I have to be extra careful about the material cool so as not to burn them. That's good. Yeah, but still, you got to manipulate it too. Yeah, possibly using like a more breathable material, one of the perforated splinging kind of materials. So I just have to say, based on that, you got it. And a lot of things that we do in therapy, we do with other ages. It's just that these age-related changes are something that many times we need to keep in mind. And so you're going to look at that, you're going to think about the strategies and look for hints in the question that are going to help you match the clinical, what the person is experiencing or their symptoms, with the best strategy for you to design an intervention. So again, age-related changes, I want us to think about this. They really do serve as a background for like an acquired condition. Again, you're aging, and then you have a stroke or you experience Parkinson's disease or whatever, can really make those age-related changes kind of go off a cliff and really make that diagnosis much more problematic. All right, questions about aging. Anybody have any questions about aging? Or we can come back to aging at the end too. You're going to study those outlines. All right, next we're going to look at low vision. And this was the OT exam item of the week, the exam item of the week. And I'm going to ask you what you put. A home care OT practitioner is working with a client who's living with low vision. What's the best compensatory strategy for the practitioner to teach the client to support their independent performance of desired activities. All right, we have 4 choices. Keep commonly used items in the same place. Store commonly used items within easy reach. Use a magnifier to locate commonly used items, or use concave lenses to locate commonly used items. Come on into the chat and put what you think the best answer was. And then I'm just going to randomly ask somebody to give me their rationale. Keep coming. Nicole, are you there?
Hi, yes, I am.
Hi, Nicole. You got A is the best answer. What were you thinking? Why did you pick A as the best answer? And we'll help you out if you get. I will. Why did you pick A? And why did B, C, and D not sound like the best answer to you? Talk to us about your rationale.
So my rationale was because I'm thinking about, since it's home care, the home environment is the most one of the most important things when determining intervention. And I thought that this would be the most efficient way rather than C and D, because using like a magnifier might not be the most helpful when it comes to looking for things that you commonly use every day.
Right.
And for B, even if it was within easy reach, they might not be able to see what kind of item it was.
Perfect. Yeah. And D too, the lenses don't really help you locate things, right? So yeah, having everything in a place where the person kind of knows where they are, then they don't have to spend a whole lot of time searching for things. And again, you were correct. Within easy reach, reach is really not the issue. It's not like they have limited shoulder movement, or, reach is not the issue. And then using a magnifier, that would be a really, as you had said, inefficient way to kind of search for things. And then concave lenses are not specifically designed to help you find things. So A is the best answer. Thank you.
Thank you.
Exactly what she said. Keep commonly used items in the same place. And that actually, to build on concave lenses, actually give the perception that objects are smaller or further away. And so they would actually, that type of lens would make it more difficult to locate items. But the question then gives us a good, sort of a good format for the questions, which goes back to are they just going to give us a diagnosis? No, they got to give us enough hints in the question to really focus our thinking frame on what might be the best answer. Good. Now, the low vision is in the OT Review and Study Guide, page 552 to 555, and there's information in the OTA Review and Study Guide, pages 511 to 513. That something I want us to think about, and it's important in a number of areas of practice, but this is an entry-level generalist practitioner exam. You know that there are people out there who are specialists in low vision, low vision specialists. And so in order to pass the certification exam, you don't have to have advanced training in low vision. We're looking at the information and application in low vision that an entry-level generalist practitioner would need. I know sometimes people work with low vision specialists, and we have a low vision specialist on our faculty. And the students sometimes just get all, we're never going to know enough as much about low vision as Julie does. And they don't have to. It's an entry-level generalist practitioner. And so what we have in the Review and Study Guide is that entry-level generalist practitioner level of information. When we think about low vision evaluation, and again, you can follow me in the Review and Study Guide, we need to know about their medical history and if they have any primary and secondary diagnosis. That's always really important. Other client factors that might impact function, especially with older adults. We have to know if they have like decreased cognition, or when I teach my course, in older adults, I say, we collect a lot of research data on older adults. And I say, you know, one of the first things we need to do is we need to do a cognitive screening. We need to do the MOCA, or we need to do the slums, or we need to do the mini mental status to just see what their cognitive level is before we go on and do a lot of other testing or interview them or whatever. We need to know what that cognitive level is. And then the client self-reporting goals. And this is something we need to think about as OTs, is that some of the activities that they used to do that were really important to them may just be a whole lot harder if they find themselves living with low vision. Things like jewelry making or counted cross stitch, or, you know, when we think of those, some kinds of activities that are really, really based on having really acute vision, they might be hard for persons. And then we also want to know about the assessment of the components of vision. Now, when we think about vision, what do we want to know? Well, you have a dominant eye, so we want to know what the person's dominant eye is. We want to know about their visual acuity, right? We want to know what their visual fields are and some information about contrast sensitivity. And we're going to look at those more specifically in just the following slides. Yeah, we're going through the therapy ed, the review and study guide. And what you'll see on the top of some of the slides is that it'll have some, I'm responding to a question in the chat. It'll have some of the pages. And so what we're doing is we're kind of going through the outline and going through some of the strategies and then thinking about how we might use that information to answer some questions. Again, so what we're going to do is look at some tools that assess these components of low vision. Now, some things I want us to think about in this slide are two important points. One is about low vision, and one is just about studying the evaluations, and we'll get to studying the evaluations in a minute. In this section of the review and study guide, there is just some very specific helpful hints for administering low vision assessments. And what we'll see that, you know, they can wear glasses, but, you know, they can't move their head for some tests. They can't move things closer for some tests. There really are some specifics for the test that people can't do because it'll impact the score that they get on the low vision assessment. So we're going to go over just a couple more of those, but keep in mind that environment part and what the client is able to do during the low vision assessments is going to be really important. We're going to look at some low vision evaluations, and I'm going to take a little bit of a 90-degree turn here. When I teach the course, the certification exam, the review course, the one area in the review and study guide that people the students or candidates just always say is, oh, why are there so many evaluations in here, Marlene? There are just so many evaluations. Can't you make that list of evaluation shorter? And I said, well, no, we really can't, because we read everything there is to read about the topic, right? And what we do is we pick out those evaluations that are in the textbooks and in the research articles and whatever. But I'm going to give you a really good way, I think, to study the evaluations, no matter what they are, including the low vision ones. What we want to think about is, first, what's the tool's name? I mean, that makes sense. What is it called? Then we want to think about what information is it going to give us, right? Like, what am I looking for? Am I looking for the person's level of independence in ADL? Am I looking for a child's level of development? Am I looking for a child's ability to do the things they need to do in school? What information is it going to provide? Because we always want to pick assessments that are going to answer questions that we have. The next thing that we want to think about is, for this one, really, what does the tool assess? But for evaluations in general, were they designed for a particular population? Now, what we're going to see in these low vision assessments is, yeah, these low vision assessments were designed for people who are experiencing low vision. But in other categories, as you look at things like ADL assessments, you're in the ADL assessment section, you're going to see some ADL assessments were designed for people who are recovering in rehab, or some ADL assessments are for physical disabilities. Some ADL assessments are for persons who are experiencing mental health kind of conditions. So what's the name of the assessment? What information is it going to give me? Was it designed for a particular population, right? And that particular population sometimes is really going to help you pick the best assessment. I did the section in the review and study guide on home safety assessments. There are 4 of them, right? And when you look at, so there are 4 home safety assessments, but when you look at who were they designed for, one was designed for people who were being discharged from rehab, assessing the home. One is designed for people who are living in the community with some level of dementia. People can live in the community with some level of dementia. One is designed to be answered by the caregiver. And then the other is just designed for the regular Joe who's living in the community. So again, these are all low vision assessments, but if you kind of think about that in terms of going through the assessments, it makes those list of assessments less daunting. These are the ones that are listed in the review and study guide. And again, we want to know what information gives us. Well, the flower design card gives us information about eye dominance. Good. The low vision LEA number chart gives us information about visual acuity. Okay. The American Academy of Ophthalmology red dot confrontation tests gives us some information. Oh, I missed the Warren text card. Suggests like the level of magnification that the person is going to need to read text. The ophthalmology red dot talks to us about confrontation. The low contrast flip chart tells us about contrast sensitivity. There's another confrontation test, the 2-person confrontation test. The clock assessment really gives us specific information about maybe macular degeneration or the location of a scrotoma. There's a self-report that gives us information about, what kind of problems do people living with low vision experience, right? It's like an ADL assessment of functional and visual performance. And then there's a comprehensive kit, the brain injury visual assessment battery that includes a series of standardized assessments. But again, looking at, what do I need to know about this person is really going to help us. Oh, see, reading through the thing, you knew we were going to be here at the last minute. So that's the way we're going to kind of look at assessments. What information do we need to know? Now, again, this is what we're going to see through the low vision section is like clients can't move their head to the target because the distance is going to change the level of reading or whatever. So again, look for these specifics, especially in this section, specific test kind of things. Now, if we think about the interventions that we're going to look at, interventions are really going to have us look at the impact that low vision can have on their ability to safely and effectively and independently negotiate their home and community. And again, much like we said when we were looking at the different systems, the interventions that we have to choose, they have to address the limitations or the challenges that the person is experiencing. And those limitations and challenges are frequently outlined in the question. So again, read the question carefully on the certification exam. If we look at interventions for persons who are living with low vision, there are really 2 kind of categories. One is client-centered and one is environment-centered. Okay. And if we look at the review and study guide and we think about client-centered interventions are those that really enable the person to use their remaining either non-visual capabilities or like training some compensatory techniques for them to use their remaining vision. It might be things like training in the use and care of adaptive equipment, or we can train people in how to more effectively use their remaining visual skills. So helping the person like change is one, changes to the client. The other broad category is environment-centered interventions. And actually, we had one of these when we did the question, right? That the environment-centered interventions focus on altering the person's environment to really better help them, give them a better person environment fit. And so when we think about something like low vision environmental simulation, might be something like increase the level of light in a person's home, you know, or reduce clutter. But again, the low vision interventions are in those two categories. You want to read questions carefully and kind of think about it. I want to end with low vision services to remind us, and we talked about this at the very beginning, is there some information that you may not be a low vision specialist. This is going to be really entry-level generalist practitioners. But it really is important. I think it's always important for us to know what the resources are out there for individuals, all individuals. But in this case, in the review and study guide, review the requirements for a person to qualify for low vision services. Again, the summary, you don't have to be a low vision specialist. Review those tools for assessing low vision and say, what do I want to know about this client? And then again, I know I'm a rehasher, but this is going to be part of the success of passing the certification exam, is be sure that those interventions that you choose or those assessments that you choose meet the needs of the client that are described in the exam question. Questions about low vision? All right, let's just go quickly through more therapy ed resources. And I think you might know about these, but let's just say that we offer certification exam prep courses, and you may know about this, that it's a one-day course for the COTA or OTA, and it's a two-day course for the OTR. So we go through strategies, test-taking strategies, review information to really think about you developing your test-taking abilities and also integrating what you need to study. So we do those. You're here at online office hours, so you know that these are here. That the online office hours, if you go to the website, you know it has a list of the online office hours and that they are from 7 to 8 Eastern Standard Time. And that we also offer tutoring. Now, tutoring isn't free, it's a fee for service. If you think that you have some special questions about content or test anxiety or whatever, if you think that you could use more individual tutoring, again, go to the Therapy Ed website and they can tell you what the times are. You can put in what your needs are, and they can put you in touch with the tutors. This is the online office hours. And again, they're going to be recorded and saved. So go to the Therapy Ed YouTube channel if you missed any of them. I didn't put dates on here because they change all the time. But these are the topics, and you'll see these topics take you through the review and study guide. On the YouTube channel, there are also some other recorded sessions that you might find interesting. There's a good one on mindfulness and the application of that to certification. And then Arita, who's the OT director, has done some frequently asked questions and answers, overview of the online office hours. So again, in addition to these instructional kinds of sessions, there are some more overview kinds of things and those are there all the time. They don't get taken down in 30 days. On Thursday, we have an original exam item that we post on social media. The one that we did about low vision was the one for this week. And you get a chance to answer it. And then we'll give you the answer on Sunday. The focus of the exam question relates to the online office hours, and we'll go through it much like we did here together. We also have a exam prep an app now that has questions for the certification exam. We're continuing to update the questions. We know that students like to study, and you don't even sometimes want to carry your computer around with you. You want to go into an app or whatever. And so we're continuing, always putting more. We know students love questions, and we're always putting more questions onto the app. We have an item writers group of the instructors, and we do that. If you think that you really want to share these online office hours with friends that you think should attend, do that, because again, they are free. All right, so let me go back to this. It is, let me go here first. If you want to leave me, then I want to wish you success in your preparation for the certification exam. You are going to pass this test. And then practice OT on yourself. You know, relax, do stress management, stay well, and stay connected. It's 7:59, so I'm going to go back here, and I'm just going to say that if anybody has any specific individual questions, I am happy to answer them. Before I do, I'm going to turn off the recording.